What to expect from your intestinal ultrasound? Explaining IUS. What if the most important breakthrough in managing your gut health wasn't a new drug, but a way to see inside your bowel in real time, without prep, without sedation, and without even taking off your shoes? In my Melbourne clinic, I'm seeing a revolution in how we monitor conditions like Crohn's disease and ulcerative colitis. For years, the gold standard meant a colonoscopy or a noisy, expensive MRI. But in 2026, we are reaching for a different tool, intestinal ultrasound, or IUS. It's the stethoscope of the modern gastroenterologist. Today, I'm taking the mystery out of this high-stakes imaging, explaining why we're obsessed with bowel wall thickness, and showing you exactly what to expect when the gel hits your skin. The first thing to understand is that IUS is a point-of-care tool. This isn't like the ultrasound you get for a gallstone where you wait weeks for a report. In 2026, I performed this right there in the consultation room. The suspense for a patient with IBD is often the not knowing. Are my symptoms a flare or just irritable bowel? With IUS, we get the answer in 60 seconds. I can see the layers of your gut wall like rings of a tree. If those layers are blurred or thickened, your immune system is currently on the attack. But what are we actually looking for? In Australia, we focus on the big three markers. Number 1, bowel wall thickness. A healthy colon wall is thin, usually under 3 mm. If I see it measuring 4 mm or 5 mm, this may suggest active inflammation. Number 2, hyperemia or blood flow. Using Doppler technology, we can see the fire. If the screen lights up with red and blue signals inside the gut wall, it means your body is pumping extra blood there to fuel the inflammatory process. Number 3, mesenteric fat. We look for creeping fat around the outside of the bowel. In Crohn's disease, this fat wraps around the intestine like a protective blanket, a sign that the inflammation has been there for a long time. The real magic of IUS in 2026 is the no prep reality. For a colonoscopy, you have to endure the prep, the liters of laxative that most patients dread more than the procedure itself. For an intestinal ultrasound, you just show up. You can eat, you can drink, you don't need a driver to take you home. It allows us to monitor how well your medication is working every single month if we need to. So if we start a new treatment, for example a biologic, and 3 months later the ultrasound shows the wall thickness is dropping, we know that we've won the battle before you even feel the clinical improvement. However, I have to be clear about the detection gap. While IUS is incredible for the small and large bowel, it cannot see flat polyps or very early stage colon cancer as clearly as a colonoscopy can. In 2026, we use ultrasound to monitor your disease, but we still use colonoscopy to screen for cancer. Think of the ultrasound as the speedometer that tells us how fast the inflammation is moving, while the colonoscopy is the full engine inspection. The takeaway is that the intestinal ultrasound is changing the power dynamic for patients. You no longer have to wait for weeks in agony, wondering if your treatment is working. We can see the truth right there on the screen in real time. It turns a silent disease into a visible, manageable reality.